Patello-femoral syndrome. In this condition, the pain is felt in the front side of the knee joint, especially around the kneecap region. Usually, this kind of pain happens when the cartilage, which is in structure that protects your knee from wear and tear, gets soft, or else due to overloading, it goes into wear and tear and can give you pain. The treatment of this kind of condition is majorly exercise therapy, electrotherapy, and sometimes anti-inflammatory medicines. Moving to second reason and second area that's common in knee pain, and that is meniscal injuries. Yes, meniscal injuries are again very common, but the location of meniscal injury pain will be different from patello-femoral syndrome. Majority of time, meniscal injury pain will be felt on the sides of the knee. So there are two types of menisci in our knee. One is called as medial meniscus and second is called as lateral meniscus. On the side in which the pain is there, that side of meniscus suggests damage. This type of pain usually happens due to unnecessary load. This type of pain usually happens due to unnecessary loading or else unnecessary fall or damage that happens on the knee joint. The treatment for this again lies in immobilization or support to the knee joint during the weight bearing phases like walking or playing, etc. Avoiding deep bending of knee. Physiotherapy or exercise therapy is very crucial, and if all of these doesn't work and the tear is major, at that time surgery is needed. The third condition is called as patellar tendinitis. Here the pain will be felt in the front bottom side of the knee joint, or else you can say pain will be felt in the base of your knee joint. This again happens due to regular wear and tear or constant friction of your patellar tendon, which is your kneecap tendon. And the treatment to this problem is unnecessary loading has to be avoided. That means try to reduce your weight. If you are overweight, then the chances of you getting patellar tendinitis pain is going to be very high. Reducing weight falling on your knee directly by footwear modification is also a very good way to reduce the pain. Quadriceps strengthening or strengthening of your front thigh muscle is also key to reduce this pain. Now coming to the fourth condition, which is called as Osgood Schroeder disorder. In this condition, the pain is felt on the insertion of the patellar tendon. Now you must be wondering what is the difference between patellar tendinitis and insertion of the patellar tendon. Now here the pain will be felt way more lower on the knee joint, especially on the shin of your bone. This condition this type of pain again occurs due to regular wear and tear and can be managed with the help of unnecessary unloading, or else you can say load reduction, physiotherapy modalities and physiotherapy exercises. Physiotherapy modalities and physiotherapy exercises. The fifth condition that can give you knee pain is called as iliotibial band syndrome. Here there is a taut structure which is on the outer side of your knee joint which gets tight and can give pain around the knee joint. Usually this pain would be felt on the outer side of the knee along with thigh region. This pain sometimes can also radiate towards this pain could also radiate towards the downward or bottom side of the leg. The treatment for this condition again lies in physiotherapy. Regular physiotherapy treatment along with exercises, footwear modification to reduce overload, weight reduction, And stretching, regular stretching of iliotibial band helps to prevent this problem further. Now comes the sixth condition, which is called as quadricep tendinitis. Now there is a muscle in our front thigh region which is called as quadricep. This muscle is responsible to keep your knee erect. When this muscle's tendon gets repeated wear and tear, at that time also it will give you pain in your knee joint. This pain would be majorly felt on the upper side of the knee, or as you can say at the base of your thigh region, front thigh region. You can also say that this pain is felt on the upper side of your kneecap. Now, to reduce this problem, the treatment lies in correcting the loading on the knee joint again. Make sure that your quadricep muscles are aligned well and your kneecap bone is also aligned well. If this is not happening, which could happen in the case where your foot positioning is not right. So footwear modification will be the key to reduce the symptoms. Along with it, strengthening of your foot muscles, calf muscles, at the same time quadricep muscle will help you to maintain the position of the knee well and will reduce the pain. Sometimes if the pain is more, then physiotherapy modalities like ultrasound, IFT, TENS can help you to reduce the pain symptoms. Sometimes if the pain is furthermore, you might need to take medications as well. Last but not the least, quadricep strengthening exercises are very mandatory when it comes to correcting this condition. Now let's have a look at the next condition, which is the seventh condition called as plica syndrome. In this disorder, pain is located in the middle and inner part of your knee joint. Especially, this will be felt behind the kneecap region. Plica syndrome is a condition which is very rare, but when in plica syndrome, a structure that is present inside your knee joint, which is called as plica, gets inflamed and irritated. Plica is nothing but a fold of synovial fluid, a fluid structure that's present within your knee joint. While plica is a normal structure present in the knee during fetal development, its size diminishes as we grow older. However, plica syndrome will be present in certain people, making them more prone to develop this disorder. This problem will typically give pain, swelling and discomfort in the front side in the center and the inner side of the knee joint. The treatment for this condition again lies in anti-inflammatory medication, treatment with the help of physiotherapy modalities like IFT, ultrasound, strengthening exercises to support and reduce the friction that's falling on the knee joint, and in certain cases surgery is also needed. The eighth condition is pes arsenis tendinitis. Here the pain is felt in the lower and outer side of your knee joint. Again, you can say this pain is felt between your knee and the shin of the bone, but in the outer side. In pes arsenis tendinitis, there is inflammation of a structure in the knee joint which is called as bursa. This condition usually results from pain. This condition usually results from overuse, direct trauma, and underlying osteoarthritis. The treatment again is very similar to the way osteoarthritic treatment is done for the knee joint. The idea is to reduce the inflammation in the knee with the help of different modalities and methods like IFT, ultrasound, heat and cold fermentation to reduce edema. At the same time, reducing weight to reduce the overload falling on the knee, giving some adequate support to the knee joint so that the knee stays stable while walking or as during loading activities, posture correction, and in certain cases surgery is also needed to ensure that the pain doesn't lie. So friends, these were the top 8 different conditions that can give you knee pain, and what are the locations of it and how it has to be managed. I hope you found this video very informative. If yes, make sure to like this video, share this video with your friends and family members, whoever is suffering from knee pain, and feel free to reach out to us if you are suffering from knee pain and need physiotherapy help. We are a team of physiotherapists who can definitely help you, whether it is at our clinic, at your home, online or offline. On that note, I'll end this video here and I'll see you in another video. Thank you.